Second question. A 58-year-old woman presents to her primary care provider complaining of fatigue and vague muscle pain in her limbs. She always seems tired and has difficulty getting through her work day and doing chores around the house. This has been going on for several months, and her symptoms seem to be getting worse. She also reports long bouts of constipation. Past medical history is significant for cirrhosis and kidney stones. She was taking acetaminophen for the pain, but that no longer provides relief, and polyethylene glycol to treat her constipation. Today, her temperature is 37 degrees Celsius, blood pressure is 110/18 millimeter of mercury, heart rate is 85 per minute, and oxygen saturation is 99% on room air. On physical examination, she has irregular rhythm, and her lungs are clear to auscultation bilaterally. Her laboratory test results are as follows: an ALT of 62, an AST of 50, total bilirubin of 1.1 milligram per deciliter, serum albumin of 2 gram per deciliter, and calcium 10.6. What is the cause of this patient's symptoms? Okay, most of you got this one right as well, so that's great. Okay, so yes, this is hyperparathyroidism as opposed to hypoparathyroidism as we saw in the previous question. Okay, so I just want you to, okay, so they're given a very, very long question. You don't have to focus on too much of it. There's just certain points that stand out, okay, rather should stand out. So the first thing you need to look at is the laboratory values, okay? I wanted to focus on serum albumin and the calcium. Now, if you just look at the calcium levels, it's 10.6, which should appear normal, right? But the thing is, you need to understand the relationship between albumin and calcium, okay? Whenever the serum albumin level is not within the normal limits, so we can describe the normal limits as 3.5 to 5.5. Anything below that, anything above that is considered to be abnormal, okay? So anytime it's outside the normal range, you need to know the relationship between this and how it affects the actual calcium value. So the calcium value that you see over here is not the total calcium value, okay? You have to, there is a formula that you have to apply to get the corrected calcium value. So I'll just show you the formula and I will, I'll just explain about it. So this is how you actually calculate anytime the albumin levels are outside the normal range. And like I mentioned, 3.5 to 5.5 is the range, but we will consider 4 to be the normal thing. So it's easier for calculation. Okay. So the corrected total calcium will be the total measured calcium, which in this case is a 10.6, plus a 0.8 into 4 minus the measured albumin, which in this case is a 2. Like I mentioned, the 4 is happening, we're using 4 over here as the normal albumin level. Okay, so 4 minus 2 gives you a 2. Multiply that with the 0.8, that's a 1.6, plus a 10.6, that gives you a 12.2. Okay, so the relationship you have to understand is that for every decrease in 1 gram per deciliter of albumin, okay, so in this case, it's 2. So from 4, that's 2 of them. So 2 gram per deciliter. So for every 1 gram per deciliter decrease in albumin, you add a 0.8 to the calcium value to get the corrected calcium. It's the inverse, okay, for the increased albumin level. If there's an increase in 1 gram per deciliter of albumin, okay, for every 1 gram per deciliter, you subtract a 0.8 from the calcium to get the corrected calcium value. And once you get that, in this particular case, the calcium value is at 12.2, which is very evidently hypercalcemia. So if you sort of overlook serum albumin in questions like this, okay, and you kind of go with only the value of calcium over here, you will automatically land up in the wrong answer, just because even though the clinical features point towards a hypercalcemia, okay, or hyperparathyroidism, the calcium value will sort of, off-put the your diagnosis. So it's important that you do look for serum albumin, especially when they've mentioned it in a question like this, okay, that they kind of, it's sort of like a hint that they give you that they expect you to, calculate the corrected calcium. But anyways, now that I've mentioned that, we will look at the symptoms. Not too much, just the main things. Okay, she's having fatigue. Okay, she has constipation, that's important. She has kidney stones. Cirrhosis is not important from this case, but it is important to rule out the first option. I'll get to that. Okay, and what else? Yeah, pretty much this. Okay, so anytime you think of hyperparathyroidism, okay, resulting in hypercalcemia or a hypophosphatemia, but in this case I've not mentioned phosphate, so ignore that. I just wanted to think of the mnemonic: stones, groans, thrones, psychiatric overtones. So this is the basic mnemonic. So stones indicating kidney stones, which this patient does have. Okay, so groans is going to be a constipation, which this patient also has, but it could also indicate abdominal pain. Okay, and the next one is psychiatric overtones, which patient can present with depression, okay, on one end, or anxiety on the other end, can also present with altered mental status. Okay, So just remember the mnemonic, and since the patient fits, kind of most of the clinical features of that, you can just confirm that it's a hyperparathyroidism. Okay, like I mentioned, cirrhosis is not important for this, but it is important for option A, which is hepatic encephalopathy, which can also present with altered mental status. And one might think just because she has cirrhosis, it could be option A. But if you look at her ALT, AST levels, they are not that elevated, and you can kind of, rule out liver failure. And it's most likely that liver failure results in hepatic encephalopathy. Not all cirrhotic patients result in this. Okay, it's end-stage liver disease. Those progressing to decompensated state, they could progress to hepatic encephalopathy. But since in this case liver function tests are pretty much normal, okay, or they're not alarming, you can just rule out hepatic encephalopathy. Okay, moreover, the other clinical features do not fit with that. And this patient can be, they will describe drowsiness, or patient appears comatose. They will mention flapping tremor or asterixis. They will definitely mention something along those lines. Okay, thyroid storm usually presents with symptoms of fever, tachyarrhythmia. Okay, you can kind of think of it. Patient's heart rate is 85 per minute. That's perfectly normal. So with that alone, you can rule it out. Also, patient's temperature is normal. You can rule it out. Okay, septic shock secondary to pyelonephritis. So the fourth and fifth option, both of them have something to do with the kidney. So though this patient does have kidney stones, which kind of predisposes her to get a UTI or pyelonephritis. As in UTI, I'm talking about cystitis and pyelonephritis, both included. But she's not presenting with symptoms of either. Okay, so in the case of septic shock, you will most likely look for hemodynamic instability. Okay, you look at her temperature as well. She could present with hyperthermia or hypothermia. Her temperature is perfectly normal. Blood pressure is also normal. Okay, in the case of hemodynamic instability, she'll most likely present with a hypotension and a tachycardia. Okay, heart rate is normal. So with just this, you can rule out option D. Option E, like I mentioned, she's not having symptoms of, cystitis. She's not having lower abdominal pain. Yes, she has pain due to constipation, but not pain as such. Also, in cystitis, fever is not very normal. So just don't get too confused with this. Since all the features point towards hypercalcemia, just go with hyperparathyroidism.
Thanks for watching. Please give a thumbs up and subscribe for more.